Ona thenge ya bururi wa Kenya kuhinga thabari cia ndege cia kuuma kana kuingira guku bururi-ini kuma bururi-ini wa India, Muthemba mweru wa coronavirus kuma India niurikitie kuingira guku bururi-ini. Kuringana na Director General wa ugima wa mwiri ndagitari Patrick Amoth, andu 18 aria maraumite India mbere ya thabari cia ndege kurugamio ni monikanite na murimo wa COVID-19, guku andu atano na aria mari mwena wa Kisumu ni monikanite na muthemba uyu mweru wa coronavirus kuma India.
In a sample of Indian travelers who are doing some work in western part of Kisumu, we have gone ahead together with the Kisumu County Health Team to do contact tracing and essentially ring fence that area, especially for local transmission from these initial primary contacts.
And I think having done those tests, we found around 18 or so that turned out to be positive with the antigen test. We have taken those tests further now to confirm through PCR testing whether they are tests, whether they are indeed positive. And we have also taken those samples for sequencing to our Kameme Welcome Trust facility in Kilifi.
Amoth augite thirikari ni gathikite mitaratara mirumu ya gutigirira ni ahota kungethanira na murimu uyu makiria cingiriro-ini itiganite cia guku bururi-ini na gucoka na thiko ugwatania wa murimu uyu ni kamweke kuri bururi na makiria counties gutigirira ni ciathi na mbere na kwihariria makiria kugikinyirwo bururi ni wagia na ikerekaria kana ria COVID-19.
This respite period to be able to work with the counties to build our capacity in terms of oxygen supply, in terms of piping, putting oxygen plants, and also putting bulk liquid oxygen tanks in facilities. And we have received support from the World Bank. So far, we have targeted 16 counties for this support, but the counties on their own, with their own revenue, we are also working closely with them to emphasize on the need for having additional piped oxygen, additional cylinders, additional liquid oxygen tanks placed in facilities.
Kwa ihinda riri gikiro kia ugwatania wa murimu guku bururi-ini kirugamire gicunji gia 11 hari igana. Umuthi andu 449 makionekana na murimu uyu, umwe wao hari mundu wa ukuru wa miaka 102. Ithabu ria rwaru guku bururi-ini rikirugamira andu 161 393.
You will note that people between the ages of 30 and 49, that's where we have the largest number of positive cases.
Gukinyaniria na riu andu 959 nio mathecetwo njanjo ya murimu wa COVID-19 na hari namba ino andu 460 nio mathukirwo ni njanjo ino. Uthuthuria makiria wa gutaukwo hihi kana kuri na dariri ingi ngurani ciumanite na njanjo ino no urathie na mbere guku bururi-ini. Ngiribotera Kameme TV riturako ni Wanjiru wa Foro.